I am joining you today along with these other officials to urge the use of face coverings for all indoor and for public settings where social distancing is difficult. And by face coverings, we do not mean the N95 masks, the high-grade surgical masks, which continue to need to be reserved for our frontline healthcare professionals. We're talking about the fabric mask or the scarf, the bandana, or the disposable but non-medical mask that can cover your nose and mouth. There are, by the way, right ways and wrong ways to wear these masks and or these face coverings. And public health has a lot of helpful information on how to do it correctly. And that will be on their website, and we're going to be sharing that on social media platforms as well. We want residents to wear face masks in all indoor situations where they're likely to be in close contact with strangers. So what are we talking about? The grocery store, the pharmacy, the hardware store. Doing this is one more step we can take to help keep those essential workers at those businesses safe. The local health directive will state that people do not need to wear face coverings outside, but they should if it's in a confined area where they're unable to get appropriate distance from others. So if you're visiting the farmer's market, for example, or you're going to your restaurant's curbside pickup, then wear a mask. For Metro, King County will now require the use of cloth face coverings. Our operators will be playing reminders about this new requirement over the vehicle's public address system. The most obvious question I expect people to ask is, why now? Well, the answer is this: we are at a precarious moment in our battle against this virus. As we've heard from Governor Inslee, the state has proposed to further loosen social distancing restrictions if the rate of infection continues to decline. To ensure we can continue along a path that leads to greater normalization, we must do everything possible to keep people safe and to avoid a bounce back in hospitalizations and death. It is critical that we continue to slow the rate of transmission, even as we increase economic activity, so that our recovery can be a one-way trip and we don't end up back in a full stay-at-home order and another shutdown of our economy.